Hi ladies, I'm Nikki Metz. I'm a physical therapist and orthopedic specialist. Today I want to share with you some tips to help with neck and shoulder pain. The tips that I'm going to share with you today are things that I have found helpful in both treating and preventing neck and shoulder pain in my patients. The first thing I want to talk about is posture. So let's talk about bad posture first. I'm going to turn to the side so that you can see. But bad posture, or posture we commonly see, is the shoulders are rounded, our back is a little slouched, and you'll notice my chin is really far away from my chest. When we have this type of posture, what happens is we have some muscular imbalances that contribute to mechanics that lead to shoulder and neck pain. So what we do want to see instead is chest up. Your chin should be tucked in, and your ear should be in line with your shoulder here. Also, our shoulders should be pulled down and back. We don't want them rounded, we want them down and back like that, so that our shoulder blades are parallel to our spine and our scapular musculature is engaged. This posture is super important because when we have good upright posture, it allows our joints to move from an optimal position. And when they move from that optimal position, it reduces the amount of stress that's placed on certain structures that really, like tendons, muscles, tissues that really don't need that extra stress. So in the other tips, I'm going to show you some exercises and things that you can do to help with your upright posture. If you're not sure how your posture looks, see if you can get a friend or a family member to take a video or a picture from you from the side, and that way you can look at those things that we talked about.
Peace, be still, my darling. All is well, my darling. Your anxious heart may as well be stone. Oh, it weighs you down deeper than you know. Yeah, it weighs you down deeper than you know. Peace, be still, my darling.
Alright, this tip is going to require either a lacrosse ball or tennis ball. Either's fine. I prefer the lacrosse ball because it's a little firmer. But with this, we're going to do some self-soft tissue massage. So I like to have my patients put it in a pillowcase because now it's easier to control it instead of having to place it on your back. You can put this pillowcase right over there and it's going to be perfect. What we want to do with this is massage the muscles of the neck and the shoulder area. This will help to reduce any trigger points that might be there. And when we reduce those trigger points, the muscle can function more optimally. So you're going to be looking to go on this muscle here and then into between your spine and your shoulder blade, as well as more from your shoulder blade over. You want to avoid the parts that have more superficial bone, like the spinous processes here in the middle, and this edge of your shoulder blade here. And you can go up to it and then get over it and go beyond that way, and you should be fine. It just doesn't really feel great if you get on those spots. So this is how you'll do it. Put it over your back, find a wall. And now I tell my patients to expect this not to be very pleasant. It shouldn't be painful in a bad way, but more painful in a hurt so good kind of way, if that makes sense. It should be something that you're doing it. It might be really uncomfortable, borderline painful, but then when you're done, that discomfort and pain settles or goes away within a minute or so. You can roll up and down and all around. That's fine, that's one technique. I prefer to find the spots that are particularly uncomfortable and just lean into that. Lean into it about 30 seconds to a minute and a half to help that trigger point release. And again, make sure you do both sides. The difference between the tennis ball and the lacrosse ball, again, is the lacrosse ball is going to be firmer and give more pressure, which I prefer. But if you're finding that it's very tender, I would start with the tennis ball.
Oh, it weighs you down deeper than